I don't think we do that. I think that what we do is we calibrate revenue in a particular way to make sure that the things that the government does and charges for pay for themselves where possible. And then we look at the most vulnerable in our economy, both those who are dependent on the government, those who are on disability benefits, those who may be getting pensions, those who are getting other payments from the government, and we up those. Those who depend on the government to regulate where they work, so people who are on the minimum wage, even though they don't work for the government. So we regulate the minimum wage and we up it again, and we've given it a considerable uplift again. And then we look at parity with the UK to make sure that the entry level to the government is where it needs to be. And then on public sector pay, we are paying calibrated again through the pay bands an amount of money which is designed to ensure that those who are on lower wages in the government service are going to be able to keep up with inflation, this time a consolidated payment as a result of the work that we've been doing with the unions negotiating public sector pay. So we're doing something in terms of what we charge as a government and something else in respect of what we do, what we give as a government and what we pay as a government. Those are two different strands, the revenue strand and the expenditure strand of what the government does.
One of the challenges has been having to devise a budget in a vacuum with no deal yet. I'm sure that you expected that when perhaps a few months ago when you thought about delivering the budget, you'd think that you would have had a deal by then. So how difficult has this proved?
Well, look, it's difficult to fight an election without a deal when you think you're going to have a deal. It's difficult to do a budget when you think you're going to have a deal or no deal, and you have neither a deal or no deal. That was last year's budget as much as it's this year's budget, and it was this election, of course. The important thing is that you keep negotiating if the deal is not right, and that you do the deal when it's right, or you know when you have to walk away because you cannot do a deal. I believe that we will be able to do a deal. I'm optimistic about being able to do a deal, and I explained in detail during the course of this morning's debate, or my presentation of the estimates at least, why I thought we could still do a deal and what it can mean. But until we have it, we have to prudently plan for the potential that we may not have a deal, and therefore we may be preparing Gibraltar's public finances for the shock of no negotiated outcome in this financial year. We have to be ready for that.
Overspend on some departments, not least the GHA and ERS, but yet you have allocated more money to them.
Well, because what we want to do is to reach a budget that is the real budget of delivering that standard of healthcare which we think is the right standard of healthcare, the top standard of healthcare on the NHS GHA system that we have in Gibraltar. So to do that, we are trying to work out where the overspend happens annually, how much of that can be controlled and how much of it is going to continue. Because it's not always an overspend if it is spending that we are all agreeing should happen. And we're trying to get that right, trying to package it in the right way, bringing health and care and the care agency and ERS together so that we have some synergies there, some economies of scale to try and reduce costs in some respects, but still deliver the same standard of care if that is possible, but being a little bit more, you might say, realistic about what the amount to be spent is, and that's what we're trying to do.
You started your budget speech with what Gibraltarians would say poniendo el parche, where you sort of spoke about the global challenges that will have an effect on the budget. So just how much of an effect have they had, would you say?
Look, Gibraltar does not operate in a vacuum. We operate in the world. There is a war in Ukraine. The war in Ukraine has raised the price of fuel. It comes down a little now, but it's still higher than it should be. But that caused inflation. Inflation affected not just Ukraine. It affected every supermarket in Europe and in the world, because the price of oil affects the price of the tractor, which means that getting the strawberries and getting the wheat goes up, and the price of bread and strawberries goes up, and everything goes up with it. There's now a war in the Middle East. A war in the Middle East could have an immediate effect on the price of fuel if it spreads. So we're very alive to those potential consequences. There's an election in November in the United States which will have global consequences. There's an election in London later this week in the United Kingdom. There'll be somebody new in Downing Street, or the same Prime Minister on Friday morning. All of these things move the needle for Gibraltar, and we have to be very alive to that, because we have to calibrate our public finances to deal with those world events. Of course, one of the things that affects us the most is the frontier, and Brexit affected us, and the negotiation is affecting us. We don't operate the public finances in a vacuum.
Chief Minister, the other bite that you felt is on borrowing and the interest rates, which you were warned against.
Well, it was very clear to us that interest rates were high, and we knew that they would come down over the 3-year period. We just did not know when in the 3-year period. That's why we didn't settle the 25-year COVID debt for that period. We have always known that. I have been warning against that, but we took the decision together in Parliament, the opposition, the GSD opposition and the GSLP Liberal government, to take the £500 million loan, because that's what we needed in order to deal with COVID. Remember, the balance was a much lower borrowing. The £500 million is what we have as a result of COVID, and we took it together. It's just a question of when to fix interest rates. We made the right decision not to fix the rate, because if we had fixed the rate, we would have fixed it at a historically high level. That's why we've made sure that we have negotiated to have a short-term loan for 3 years, so that by the time that we fix for the remaining 22 years, we will be at the lower rates that we expect are coming. And I think we've been proved right on, whilst others were saying that they did not think that the rates would come down. They are coming down, not as fast as anyone would like, but they're coming down, and they're coming down in the period of the 3 years. The point I was making is that the Bank of England has not been able to reduce the rate this round because there's a general election on in the United Kingdom, and they can't be seen to move the rate up or down whilst an election is on, because one party or the other might claim that this goes to their advantage and proves their argument right. So it's a little delayed, but we see those steps hopefully coming in coming months.
Money doesn't grow on trees, and people know that from their own bank accounts. But do you think that the electorate sometimes doesn't seem to be aware of this? For example, a lot of people stayed at home during COVID. They had the health. Now it's payback time for some of the things.
We introduced measures during COVID to pay the salary of everybody who worked in our economy, even though they couldn't work because we locked them down. We provided Rolls-Royce healthcare in Gibraltar. We had all of the PPE that our health professionals needed. We wanted for nothing during COVID in Gibraltar. We worked together as a community across the political divide. We created the BEAT measures. We ensured that we had everything that we needed in Gibraltar for COVID. And I think that today, what we have to do is make sure that we are not simply kicking that can of borrowing down the road. We are collectively working to pay that together from the first moment, even though it will take time. It is a multi-generational problem. These pandemics come one every 100 years. So actually paying for it over 25 years is not a bad way of us settling with the future and future generations the benefits that we had during that period where we were able to provide for all those who stayed at home, etc., etc. Although I didn't get to stay at home, I worked every day, like did our national broadcaster, making sure that we got the message out to people.